I'm very much into systems thinking. I like a systems approach, and I like the approach that people understand what the big picture is, because I think people will always react better if they can actually see the end game, even if they know they're only a part of that cog. Health is a good example of a very large, complex organisation. I've always described health as an economic sort of Rubik's Cube, because it's labour intensive, capital intensive, transaction intensive. So when I started at the Launceston General Hospital as the CEO, we had to undergo a range of changes. We were facing being subject, instead of block funding and historical funding, and effectively historical deficit funding, because we rarely didn't balance budgets or go into a surplus. But the Commonwealth was introducing activity-based funding, which was basically an average price across Australia. So we needed to understand that, and we needed to understand our costs, and we needed the staff to understand what that actually was going to mean for us. At the same time, we had the global economic crisis, so there was less money. At the same time, we had the biggest capital works building program Launceston had ever seen, and we were facing a number of other challenges, particularly with IT and workforce, some of which didn't eventuate. The foreshadowed nursing shortage didn't occur. Interesting enough, I suspect, because of the global economic crisis, that is, staff couldn't afford to retire in an ageing workforce. So the approach I took, which I borrowed from work of Alistair Mant, who I strongly recommend, he worked very early in his career with Sir William Hudson, who was the engineer behind the Snowy Mountains scheme. And what Alistair was influenced by, it's in his book Intelligent Leadership, that Sir William Hudson would require the engineers and the shift managers to meet with each of their shifts regularly and explain to them what the big picture of the Snowy Mountain scheme was. And they used diagrams, given the Snowy Mountain scheme, as Tasmanians would understand, because a lot of them came from that to then make the hydro work in Tasmania and are still here as their descendants. There was something like 30 or 40 different nationalities and languages. So they used diagrams to say, this is where we are, this is what we're building, we're underground, we're doing this, we're building these power stations, we're diverting the Snowy River to drive this hydro. So that was really quite powerful as telling the picture. And I often find in health that we deal with different parts of the body. We're a subspecialty model, we're highly educated, but rarely do we necessarily understand all of it. And certainly we don't understand the financing and some of the strategic. So I spent a fair bit of time both trying to get all of those pressures down onto one page. It ended up being a double A4, whatever that is, a B2 or whatever, B1. So it didn't quite get down to one A4 page because it was a bit complex, looked a bit like an octopus. But there was 4 or 5 major drivers, and I made a point of going around to each of the areas, each of the shifts in my first 6 months, and handing it out and explaining it and answering questions. Some of those were very quick meetings, but some of those were very long meetings, and then following up if people had any question. So they understood that the rules were changing, that we needed to change, otherwise we'd be in trouble, and the opportunities that arose, particularly because we were fortunate enough to start with what was an $11 million capital works program, which we grew to over $120 million. So we were able to rebuild a large part of the hospital at the same time, and position us well for the future in the next 30 or so years. So using the picture, using the story, explaining why staying still or doing what we've always done wasn't going to be possible, but also allowing them to speak to the CEO directly in that, I think, and I learnt that out of that work of Sir William Hudson, who was a very clever New Zealand engineer, interestingly enough, because I think that helps in a complex organisation where people are involved with different parts of it.